Hello, everyone. My name is Piyali Bhattacharya, and I'm a third-year PhD student in School of Psychology at University of Birmingham. Today, I'm excited to present our public engagement funded project funded by the University of Birmingham aimed at addressing autism in India. Before diving into the project specifics, I want to briefly mention about what autism is, specifically for those who are unfamiliar with the term. Autism is basically a neurodevelopmental condition characterized by differences in social communication, social interaction, and repetitive behaviors or restricted interests. The American Psychiatric Association defines autism as a condition present from early childhood that impacts everyday functioning. As you have figured out from the title slide, this project was conducted in India. You might be wondering why? Why India? Let's take a look at the scenario of autism in India. Mental health conditions in India are perceived as taboo. The diagnosis of autism is a relatively new phenomenon in India compared to the West. Autism was recognized as a disability for the first time by the Indian People with Disabilities Act in 1995. Estimates from across the globe suggest that around 1 to 2% of people have autism. Whereas it is quite surprising to see that the inference driven by the school enrollment data available from the Government of India, which was last updated in 2019, suggests that only 0.008% school children reported to have a clinical diagnosis of autism. This means that India potentially have several million people with autism, many of whom remain undiagnosed. The major population resides in rural areas where knowledge about autism is even more limited. Looking at some more statistics here, research shows that around 40% of autistic adults in India stay at home with limited external contact, and only 7% are employed primarily in sheltered vocational centers. Many autistic adults continue to attend special schools well into their 30s and 40s, highlighting the need for better support and opportunities. These are all data from urban areas in India. Indian rural residents experience significant disparities in mental health outcomes, despite the prevalence of mental illness in rural and metropolitan areas are quite similar. Public engagement can help address some of these disparities by bringing together mental health care professionals, policymakers, NGOs, autistic adults under one organization. Our program was aimed at strengthening an autism support network in rural areas in West Bengal. So our project had four main objectives. First, raising autism awareness at multiple levels, which includes individual, interpersonal, community, and societal levels. Second, enhancing community support. Third, facilitating communication among rural residents and mental health care professionals and other key stakeholders to strengthen mental health system. And last but not the least, empowering rural areas in India by giving them access to specialized care and support and helping create an auxiliary network of champions for the differently abled. Each of these objectives is very, very crucial for improving the quality of life for autistic people and their families in rural areas. So what we basically did, we started with collaborating with multiple organizations, and two key organizations are the Pradeep Center for Autism Management and Sancha Arod. These organizations are located in West Bengal, and both of them work actively with neurodiverse populations. These are some of the clips from our visits to rural villages where we conducted our activities. Uh, On the first day, we engaged with around 15 stakeholders, including government officials, psychiatrists, psychologists, special educators, professors, researchers, autistic advocates, even parents of some autistic children. My supervisors have also joined us virtually since they couldn't make it to India. Um, these engagement with stakeholders was aimed at strengthening an autism support network through the exchange of lived experience, knowledge, and partnership building. These discussions were essential in understanding the current challenges and needs to gather diverse perspective and to create a comprehensive approach to address autism in rural areas in West Bengal. Uh, on the second day, we continued our public engagement efforts with a wider audience. The event aimed not only to educate the rural residents, but also to cultivate positive attitudes towards autism and inspire them to consider approaching and using mental health care services. Professor Mallika Banerjee, who's also my Indian supervisor, also gave an enriching talk. The engagement helped us reaching out to grassroots communities. Further activities on second day involved helping parents to understand the importance of early diagnosis and intervention, as well as multidisciplinary intervention. This approach aimed to create awareness among parents to spot the early signs of autism in toddlers and to explain the need for a diagnosis to parent sensitively. Uh, we also held an open exhibition in an open space where attendees could view posters to better understand autism. Here are some feedbacks that we have received from the participants and the attendees from the event. The feedback really highlighted that the event was highly informative and an eye-opener for many. They also expressed a desire for future initiatives and emphasized the need for more awareness programs and suggested that information be shared regularly in schools and community centers in rural areas. Our future efforts will focus on continuing to raise awareness about autism in rural India through public engagements and expanding the reach of mental health infrastructure across rural areas in India. I would like to extend my gratitude to the entire team, my supervisors, the collaborators, and the Public Engagement Fund, without which this event wouldn't have been possible. Thank you so much, everyone, for your contributions and support. Uh, for further information and to know more about my project, you can contact me via email or connect with me on LinkedIn. Thank you for listening.